Good evening. I'm Rear Admiral Boris Lushniak, Acting Surgeon General of the United States. I know that Mollies Fund believes first and foremost that public education is the greatest weapon in the war against melanoma. Your tireless efforts during May for Melanoma Awareness Month and throughout the year are proof of this dedication to education. Well, I couldn't agree with you more. You may have heard by now that in late July, my office released a new call to action to prevent skin cancer. So your work is critical for addressing this growing problem. Rates of skin cancer are increasing. Over the last 3 decades, the number of Americans who have had skin cancer is estimated to be higher than the number for all other cancers combined. Nearly 5 million people in the U.S. are treated for skin cancer every year, at an average annual cost of $8.1 billion. Melanoma is the deadliest form of skin cancer. Each year, more than 63,000 new cases are diagnosed in the United States, and nearly 9,000 people die from this disease. Rates of melanoma increased more than 200% from 1973 to 2011. Melanoma is also one of the most common types of cancer among U.S. teens and young adults. And while there are genetic risk factors for skin cancer, such as light-colored skin and a family history, these are not modifiable. Where we live relative to the equator can also be a risk factor, but that is also not something most of us are likely to change. We must do more in the areas where our actions matter, in prevention. We as a culture have a very flawed perception about tan skin. We need to shatter the myth that tan skin is a sign of health. Let's be very clear about this. While sunburn prevention is important, it's not enough to prevent skin cancer. Tan skin is not healthy skin. Tan skin is damaged skin, which also can lead to skin cancer. More than 400,000 cases of skin cancer, about 6,000 of which are melanomas, are estimated to be related to indoor tanning in the United States each year. Exposure to ultraviolet light is a major cause of skin cancer, and it is the most preventable cause. Even though 44 states plus the District of Columbia have adopted laws regulating access to indoor tanning, 1 in 3 white women between the ages of 16 and 25 still engages in indoor tanning each year. Every tanning session increases a person's risk for melanoma. I have to tell you, there is no easier way to prevent cancer than walking past the open lid of a tanning bed. Sun exposure is a little more difficult to avoid than deliberate indoor tanning, but let's start with no more tanning. Go outdoors, be active, enjoy life, but don't go out in the sun for the express purpose of sunbathing. A call to action is precisely that, an impetus for all sectors of our society to take action against a problem that is affecting the health of our nation. Let's work together to lead the way and create sun-safe communities for all our children, youth, and families. You can help by demanding that your neighborhoods and communities have more shady spaces for our outdoor recreation areas, schools, parks, and playgrounds. You can advocate for sun protection policies to be in place for our workplaces and schools. We need to build on the existing efforts to regulate indoor tanning appropriately, especially for our young people. Let's also keep the commitment to ongoing learning about effective strategies and policies by supporting the research on this topic. You need to continue the great work you are doing to educate more people about preventing skin cancer and making the healthy choices when it comes to ultraviolet exposure, both indoors and outside. And we can all be good role models for our children and youth by enjoying the outdoors safely and avoiding sunbathing and indoor tanning. By working together on all these fronts, we hope that the next generation can be spared from this tragic but preventable disease. The time for action is now. These are steps all of us can take, and together we can prevent skin cancer. I am proud to know that Mollies Fund is working with us on this call to action. Thank you to Jack and Maggie Begain and all of you here tonight for all that you do to increase awareness of melanoma and skin cancer prevention.
All of us in the melanoma community are elated to learn that skin cancer prevention is now a national goal. Mollies Fund continues to be aggressive in the war against this epidemic. Your encouragement and support has permitted us to expand our public service announcement campaigns. Our taxi PSAs continue to educate millions of New Yorkers and tourists. These public service announcements have also aired on all of the major networks and have been viewed throughout the United States. The New York City subway, the busiest rapid transit system in the country, featured our attention-grabbing posters. Our PSAs on the exteriors of buses reminded the public about sun protection. During the summer months, we sponsored radio announcements warning listeners to be vigilant in the sun.
Hey fans, the Yankees are heading out under the sun today. The Molly Begain Melanoma Foundation wants to remind you that when you head out to protect yourself, seek shade and wear sunglasses and protective clothing. Yankee fans, practice safe sun.
We continue to make an impact in the nursing community by sponsoring skin cancer educational forums. We organized and sponsored programs for the nursing staff at Winthrop University Hospital, Mercy Medical Center, NYU Langone Medical Center, and North Shore Long Island Jewish Hospital. Nurses are reminded of their responsibility to educate their patients about skin cancer and melanoma.
Nurses are the one person who assess the body completely and assess a patient completely from head to toe and are able to, even in times where they're not looking for it, identify an early skin cancer.
We are also honored to be named again as the presidential charity by the New York Society of Physician Assistants. By providing skin cancer education initiatives to the nursing and PA communities, Mollies Fund believes that these collaborations will have a ripple effect impacting millions of patients. Mollies Fund is particularly focused on changing behaviors in young adults. At our annual May Sun Safe Assembly at the Garden City Middle School, students learned about the dark side of the sun. Assistant Principal Mrs. Lee encouraged the sixth graders to share with their family and friends the important lessons learned in the presentation.
Please understand, stay out the sun, it comes from a tan. Stop melanoma, please don't forget, use sunscreen, do a skin check.
Our junior board, under Kara and Julie's direction, has spearheaded our social media campaigns. Our Facebook, Twitter, and Instagram audiences continue to grow and keep our prevention message current and relevant. Katz's Corner is a Sunday 7 a.m. call-in radio show broadcast on 77 WABC, hosted by Dr. Aaron Katz. The show is dedicated to giving straight talk about medical conditions. On June 22nd, their broadcast was devoted to skin cancer. Julie and Kara joined Dr. Anthony Rossi, dermatologist at Memorial Sloan Kettering, as guests. Julie and Kara discussed their sister's battle with melanoma and the mission of the foundation to increase awareness and prevention.
Because Molly was 20 years old when she was diagnosed and passed away, we're really trying to focus our attention on the younger audience. We start with middle schools, high schools, colleges to get the word out there because we feel like this is the time where people are really building their habits.
Area 23, a New York City-based advertising firm, approached us this year in partnering on a new public service announcement aimed at changing the behaviors of indoor tanners. We believe their idea is powerful and will make a strong impact on a younger YouTube audience. They are currently in the pre-production stages and are optimistic that the project will be complete by next spring.
So we're going to invite real people to a fake tanning salon, and when they arrive, they are going to be made very aware of the deadly consequences of tanning. And we're calling it Free Killer Tan. And we're really planning out how are we going to pull off this stunt. It's a complicated stunt with a lot of moving parts, and it really is going to take a big team to figure this out.
Obviously the video could be broken down into a lot of different pieces. Maybe it's something you would see in a magazine. We talked about it's in the back of a New York City taxi cab, the video screens that they have. Maybe it's on top of cabs or on buses. I think we're initially going to look for all the different ways that we can make this more than just a one-off piece. Because there's so much heart for it, both here and at Mollies Fund.
None of this would be possible without your support. We would like to extend a very special thank you to all of our volunteers and both of our boards for their ongoing vision and support. We thank you sincerely and look forward to the coming year for more opportunities that will enable us to save lives from this horrific disease. In Molly's name, we thank you.